Leg and arm extensions. This stretch is often performed using a Swiss exercise ball as demonstrated by Johanna, although it can also be done without as demonstrated by Mohammed. Lie face down on the ball, or if you're not using a ball, simply position yourself on all fours on the floor and gradually extend your left arm whilst using your right arm to support yourself. Hold this position and gradually extend your right leg behind you. Relax, then do the same with the opposite limbs, using your right arm and your left leg. Repeat this 5 times, alternating back and forth between left and right.
Stand in a doorway. Place your feet close to the door frame and cross your outside leg over in front of your inside leg. Hold onto the door frame with your outside hand above your head. Then lean away from the door frame until you feel a stretch along the side of your body. Hold this for 30 seconds. Rest. And then repeat twice more on this side. Once you have done a total of 3 repetitions on the first side, turn around and do 3 repetitions on the other side.
This is a very simple routine that builds strength, improves your posture, and requires nothing more than a flat wall to stand against. Although this exercise can also be carried out whilst lying on the floor. Start off with standing with your back to the wall and your feet roughly 20 centimetres in front of you. Your head and shoulders should be pressed firmly against the wall behind you. Now, push your lower back towards the wall without moving your upper back or shoulders. Hold this position for a few seconds, then take a few deep breaths, then relax. Repeat this 5 times. This can also be replicated on the floor.
This exercise is the pectoral stretch. It aims to stretch the pectoral muscles at the front of your shoulders. These are often tight in patients with scoliosis or hyperkyphosis. It requires no special equipment and can be done in a suitable doorway. Position yourself in a doorway facing into the room. Place your inside arm at 90 degrees so that it's in line with your shoulder. Place your forearm against the door frame with your elbow bent to 90 degrees. Then step forwards with your inside leg. Be sure to keep your forearm in the door frame. Lean slightly forward so you can feel the stretch in the front of your chest and hold for 30 seconds. Rest and then repeat twice more on this side. When you have done a total of 3 repetitions with the first shoulder, turn around and do 3 repetitions on the other shoulder. Things to be careful of when carrying out this exercise. It should not be painful. If you experience pain, then please stop immediately and consult your doctor. However, this exercise does stretch muscles, and so you may experience some mild aching and/or pulling sensation. Make sure your body does not twist during the exercise.
Spinal elongation. Elongation is an important part of treating scoliosis effectively. This exercise requires the use of wall bars or a chin-up bar securely fastened in a door frame. Breathe in, bend your knees to 90 degrees and drop your pelvis down towards the floor. Pull your body up slightly as you exhale, taking care not to raise your shoulders. Hold this position for 6 seconds. Breathe in again and allow your spine to lengthen and your pelvis to drop down again slightly, keeping your knees at 90 degrees. Repeat this 3 times, relax, and come to standing.
The exercise we're going to teach you today is called threading the needle. This exercise aims to increase the mobility in your thoracic spine. It requires no special equipment, just something to protect your knees, for example, an exercise mat or a towel. For this exercise, you need to place your hands and knees onto the floor. Keep your hands under your shoulders and your knees under your hips. Slide your right arm under your left arm as far as you can until you feel a stretch through your thoracic spine. Then open your chest out and reach the same arm up towards the ceiling, pushing away from the floor with your supporting arm. Repeat this 10 times with the right arm. Once 10 are complete, you can switch to the other side for a further 10 times.